Hello, my name is Mahan Mathur, and this is the fourth video in our lecture series on Introduction to Radiology. And in this video, we'll cover magnetic resonance imaging, or MRI. And the objective that I'd like you to get out of this presentation is to be able to identify the difference between basic MRI sequences, specifically what a T1 weighted sequence looks like and what a T2 weighted sequence looks like. And we'll go about doing this by covering a few basic principles of MRI imaging, and we'll then dive into the imaging sequences themselves. So here's some basic principles for MR imaging. Now it turns out that the body is composed of multiple tissues. Many of these tissues contain hydrogen, right? We have made up of a lot of water, so there's a lot of hydrogen there. There's fat, there's carbohydrates, there's amino acids. We have a lot of hydrogen in our body. Now hydrogen itself is made up of one proton and one electron. The proton actually rotates around its axis, as you can see in this diagram over here. And if we go back to principles of electromagnetic imaging, we'll recall that any moving electric charge creates a magnetic field. So if we think about it in some other sense, our body is actually made up of many little tiny magnets, each of which is a hydrogen atom. And normally these are randomly distributed throughout our body, and thus the net magnetic moment cancels each other out. So how can we use these principles to explain how we get MR images? Well, we insert the patient into a giant circle. In the circle, there is a strong external magnetic field. We're talking about 1.5 Tesla or 3 Tesla magnetic fields. As a result of this external magnetic field, most of these hydrogen atoms will align with the field. Few will align against it, but most of them will align with the field. Now what we're able to do is then impose a temporary electric current through a radio frequency pulse. This allows us to scatter the hydrogen protons in all different directions. Now if we take this radio frequency pulse away, the hydrogen protons will once again align with the external magnetic field. Now this will happen differently based on the tissue that this hydrogen proton is contained in. Again, remember that the hydrogen proton is like a little electric charge, and as it moves back to its equilibrium with the strong external magnetic field, it will create an electric charge, and this can be measured. And once we measure these electric charges, we can convert that to a signal that gives us the MRI images. So the basic measurements that we make result in T1 and T2 weighted sequences. There are a few different names based on the different vendors that supply these MR magnets, but these basic sequences are T1, T2 weighted. We can have fat saturated images where everything that contains fat in the body is made to have zero signal, null signal, which appears black, and we can do imaging sequences after we give intravenous contrast. What's the basic difference between T1 and T2 weighted images on MRI? Well, fluid looks bright or white on T2 weighted images. So let's use these principles to go through a few imaging sequences. So if we evaluate the following two images, image 1 and image 2, which one do you think is T1 weighted and which one do you think is T2 weighted? Well, for this, we need to look at structures that we know contain simple fluid. And a good way to go about doing this very quickly is to look at the cerebrospinal fluid that bathes the spinal cord. That's going to be simple fluid. It'll always appear very white or bright on T2 weighted images, hence image 1 is the T2 weighted image, and image 2 is the T1 weighted image. We can also look for other structures that contain fluid, such as the gallbladder, which contains bile, which is just simple fluid here, as well as the bowel, which contains fluid as seen in the jejunum over here. How about these two images? Are these T1 or T2 weighted? What is different about image number 2? So both these images are T2 weighted images. We can see that the CSF, the cerebrospinal fluid, is white or bright on both these images. The difference here, however, is if we look at the subcutaneous fat within the patient, all of that is much darker on the image number 2. And so this is what we call a T2 weighted image with fat saturation. So we can apply an external signal to make sure that all the fat in the body becomes very dark, and we can use this in order to detect pathology in the patient. How about these two images? Are they T1 or T2 weighted? What is different about image number 2? So if we look at these two images, both of them are T1 weighted. If we look to our cerebrospinal fluid, it has a gray or relatively dark signal on both these images. So these are both T1 weighted images. The difference between this image and this image is that once again the fat in this second image is dark. And so we simply say this is a T1 weighted image with fat saturation. How about these sets of images? Are they T1 or T2 weighted? And what is different about image number 2? So if we look at both these images, we see that the cerebrospinal fluid once again is dark in signal, so we know these are T1 weighted images. If we look at the fat, it's also dark, so we know both of them are T1 with fat saturation. But the big difference between number 1 and number 2 is that the aorta is much brighter on image number 2, and that the kidney and the spleen and all the other organs are much brighter on image number 2. Therefore, this is a T1 weighted, fat saturated image after we've given intravenous contrast. This is what post-contrast images look like on MRI. So what are some ways in which we can differentiate MR imaging from CT images? Well, for one thing, MR imaging is very good at depicting the soft tissues. The soft tissue contrast resolution is much better than on CT imaging, and what that means from a practical perspective is that you have an ability to differentiate the internal architecture of different soft tissue structures, the muscles from the tendons, from the bones. And so for example here, we have a sagittal MR image of the knee, and we have side by side a CT image of the knee in a sagittal plane as well. In general, we can see that the cortex of osseous structures is very dark, has a black signal, while the marrow, which contains a variable amount of fat, can have relatively bright signal on most MR imaging sequences. Compare that to CT scans. Because the bone is so dense, it appears much brighter than any of the other structures on the CT images. When we examine the subcutaneous fat around the patient, in sequences that are not fat saturated, that fat signal will be relatively bright, while in CT imaging, subcutaneous fat has a very dark signal with a Hounsfield unit lower than -20 in general. If we look at some other structures, we can see very nicely the differentiation of muscles from the tendon of the muscles. And if we look at the knee joint itself, we can see the different ligaments around the knee joint as well as the cartilage, which is very difficult to differentiate on the CT images. If we look at this axial T2 weighted image of the brain and compare it side by side to an axial non-contrast CT scan of the brain, we can see that on the MR images, the internal architecture of the brain itself is much better seen, with the different gray matter and white matter tracks much better delineated, as opposed to the images of the CT scan where everything appears relatively gray and homogeneous in its appearance. We can also note that on this T2 weighted image, the cerebrospinal fluid is bright as would be expected on T2 weighted imaging, while on the non-contrast CT scan it's dark. And if we look at the bones, the cortex once again on the MR images is very dark, while the marrow demonstrates a variable amount of bright signal depending on the amount of fat it has within it, while on the CT scan it appears very bright as it is made of a denser material. So in summary, our body is made up of multiple hydrogen atoms, and each of these hydrogen atoms act like little magnets. When we place our body inside a strong external magnetic field, the majority of these hydrogen atoms will align with that field. Now, if we're able to deliver an electric pulse that scatters these atoms, they'll go in all different directions. If we take that pulse away, once again, these hydrogen atoms will align with the strong external magnetic field. The rates at which they align result in electric signal that can be detected by a computer, and this results in T1 and T2 weighted images. Of course, different tissues that contain these hydrogen atoms will realign differently. Our basic sequences are T1 and T2 weighted, and if a quick way to differentiate those two sequences is to look at the fluid. Fluid is bright or white in appearance on T2 weighted images. Thank you for your attention.